All right, what we're going to do now, as Sherry said, is we're going to talk about what happens inside the brain. We're going to talk a little bit about what happens from a mental health perspective, but we're going to talk mostly about what happens when people take substances to their brain and to their cognitive functioning. All right, so we're going to talk mostly about what happens in the brain as a result of addiction. Because if you don't understand how the person changes the way that they think in the face of their substance use, your interventions can't be as successful, right? Because a lot of times, basic stuff that we think that most people should be able to follow us through, I'm going to show you pretty definitively, people who use drugs can't necessarily do that. We need to adapt to them, not expect them to adapt to us for our services to be effective. Now, first of all, if we look at mental health issues, we tend to gather our mental health disorders at about the same time in our development. And if you look at early development, you see the first thing that appears is generally attention deficit disorder, or ADHD, which we generally see the first symptoms at about 1 to 2 years of age. It's almost never diagnosed then, though. When's it usually diagnosed? Elementary school, that's exactly right. When the kid starts interacting with their peers and someone who's knowledgeable, a teacher, says, look at this kid bouncing all over the wall, what's up with him? That's when it's usually diagnosed. Until then, the poor parent is like, why did I ever have children, right? Because they think that all children are like this. They don't really have anything to compare it to necessarily. So while this is the first to appear, generally we begin seeing diagnoses first of things like oppositional defiant disorder. Kids who are purposefully just say, I ain't doing that, and begin to defy parental and other authority. Anxiety disorders, a little earlier than that actually, we begin to see symptoms of anxiety around 4. Conduct disorders is the next one that follows. Then, as we enter into pre-adolescence and early adolescence, we begin seeing some of the more major kinds of disorders. Depression happening there, and then in the mid to late teens, actually, or early 20s, we begin to see the development of psychotic disorders and those kinds of symptoms. This kind of progression of mental health disease is really important when you think about this progression, which is the progression from a non-user of substances to someone who uses substances. And in some ways, we begin to see a parallel. Whereas early on, there isn't a lot of use going on, hopefully. I have treated a few kids whose parents introduced them to drugs at 4 or 5 years of age and had very long histories of drug use by the time they were in their teens. But that's fairly abnormal in terms of the normal development. What we generally see is somewhere between 8 and 11 years old, the beginning of experimentation. 10 years ago, by the way, I would have added 5 or 6 years to that. But now we are seeing kids as young as 8 beginning to experiment with some of these substances. We then move on to mid-adolescence and we begin seeing some social use and the development of problems. And what we see is markers along the way that indicate that while some of these kids are using socially, some of these kids are clearly beginning to escalate their use at the same time that they're developing some of these other problems. In other words, they're trying to mitigate some of the effects of some of these mental health disorders with their use of substances. They truly have co-occurring disorders. Sherry talked a little bit about the importance of teasing out that diagnosis of what falls in this category and what falls in this category. How do you do that? Anybody? How do you tell? Someone comes in, they're using substances, and they're really depressed. How do you tell what's what?
Look at history.
Yeah, look at history. Absolutely. And you've got a client sitting in front of you who's an ongoing meth user. How good a historian are they going to be? Probably not very good, right? So the one thing that we have is history to be able to separate those disorders out. How else do we tell? That's the right answer. You can't. Right? Until we get them away from the substances and we see if the symptoms still persist. And so we have to operate without knowing for a period of time, try to get them away from the substances, and then figure out what's going on. Were you going to say something?
Oh, just that often it's very difficult to tease out, because especially substances like cocaine and methamphetamines, where people are abstinent for days at a time, depending on what their level of use is. It's so hard to separate that from any kind of like bipolar disorder, depression, whatever might be there.
Exactly.
I really can't tell you. I haven't had a long period of time to know that was separate from the alcohol or drug use.
And from a systems perspective, we have to diagnose according to the symptoms that are there, and if they're having mental health symptoms, we have to treat them for those mental health symptoms. But we don't want to label them too strongly and too firmly with some of those major mental health disorders until we really have had the time to know for sure. So keeping them involved in the system becomes really important. What are we talking about? Heredity and environment play a role, characterized by chronicity and denial. Affects the whole family, progresses without treatment, has feelings of guilt and shame, inability to control behavior and emotions. It's often seen as a moral issue, leads to feelings of despair and failure. Biological, psychological, social, and spiritual components are involved. Mental health problem, addiction problem. Which one? Yeah, that's the answer. It's both, of course. In other words, not only can we not tell with whatever they bring to us, but all of the myriad of issues that they bring to us are so intertwined with both mental health and substance use that we have to simply treat the symptoms that are in front of us and not worry quite as much about, am I dealing with a substance user or am I dealing with someone who has a primary mental health condition? You're dealing with someone who's hurting in a lot of different ways, and we have to deal with that. Differential diagnosis is important, at least in terms of our thought patterns. We have to begin to think about, how do I address this issue and what coping am I looking at in order to begin to develop a treatment plan? So while we may not be able to tell definitively, we have to look at the symptoms and try to figure out, are we talking about depression, or are we talking about alcohol, prescription painkiller, or heroin use? Is it ADHD or methamphetamine or cocaine use, bipolar disorder or cocaine use, schizophrenia or methamphetamine use, PTSD or polysubstance use? Again, we can't know for certain, but if we say, wow, when this person uses more, these symptoms become exacerbated, so lowering their use becomes really important. Or, when this person uses more, they seem to feel better. So really, we need to address this underlying mental health issue that they're treating so that we can help them feel better without using those other substances.